Hello everybody, how are you? My name is Eihab and I'm from grade 9. Today I'll be talking to you about the coronavirus pandemic. Many people may wonder, what exactly is the coronavirus? It's a large group of viruses that are known to infect both humans and animals. And in humans it causes respiratory illness that range from common colds to much more serious infections. COVID-19 affects different people in many different ways. Most infected people will develop mild to moderate illness and recover without going to a hospital. Common symptoms of COVID-19 are fever, dry coughs, and tiredness. Where and how did it start? The first human cases of COVID-19 were first reported by officials in Wuhan City in China on 30 December 2019. The disease appears to have originated from a Wuhan seafood market, where wild animals including marmots, birds, rabbits, bats, and snakes were traded illegally. Coronaviruses are known to jump from animals to humans, so it's thought that the first people infected with the disease contracted it from contact with animals. What started as an epidemic mainly limited to China has now become a truly global pandemic. There have now been over 5,595,091 confirmed cases and 350,547 deaths. The disease has been detected in more than 200 countries and territories. And as we all know, the coronavirus has affected our lives in many ways. And basically, our routines have totally changed. The number of people living alone has decreased. Young people under the age of 30 have begun to live with their families. Approximately, domestic violence has increased 22%. That's because family members have been started to spend time together much more than usual. In this term, even if couples have been starting to get to know each other better than usual, divorces have started to rise. The research revealed that more than half of the people had changed the habit of their eating. News started to be followed mostly about 82% from television and 52% from the internet. Social media usage increased significantly among people under 25 and over 56. 60% of people have changed their sleep routine. The coronavirus has changed how we work, play, and learn. Schools are closing, sports leagues have been cancelled, and many people have been asked to work from home. How are you dealing with these sudden and dramatic changes to how you live? Are you practicing social distancing? And are you even sure what that really means? What is social distancing? It's the idea to maintain a distance for about 6 feet between you and other people. That also means minimizing contact with people, avoiding public transportation whenever possible, limiting non-essential travel, working from home and skipping social gatherings, and definitely not going to crowded areas. How does COVID-19 spread between people? Current evidence suggests that COVID-19 spreads between people through two methods: direct and indirect methods. Indirect method as through contaminated objects or surfaces, while direct method as through a close contact with infected people via mouth and nose secretions. These include saliva, respiratory secretions, or secretion droplets. These are released from the mouth or nose when an infected person coughs, sneezes, speaks, or even sings. People who are in close contact within 1 meter with an infected person can catch COVID-19 easily. To avoid contact with these droplets and to prevent the spread of COVID-19, here are some health and safety tips to follow. Wash your hands often using soap and water or an alcohol-based hand rub. Use hand sanitizers. Wear a mask, but take care. Masks can help prevent the spread of the virus from the person wearing the mask to others. But masks alone don't protect against COVID-19 and should be combined with physical distancing and hand hygiene. Don't touch your face, eyes, nose, or mouth. Cover your sneezes and coughs with your bent elbow or a tissue. Avoid close contact with other people. Use your own supplies. Clean your electronics. And lastly, stay home if you feel unwell, and if you have a fever, cough, and difficulty breathing, seek medical attention directly. Calling in advance allows your healthcare provider to quickly direct you to the right health facility. This protects you and prevents the spread of viruses and other infections. Protect yourselves and others around you by knowing the facts and taking appropriate precautions. Follow advice provided by your local health authority. And finally, wear a mask, save lives. Stay home, stay safe. Thank you.